Hello everybody, I am Dr. Lee Coleman, and I am especially happy that you're here for this session and for a few sessions coming up. If you have been watching, you know that I have introduced you to my concerns about what is happening and has been happening to psychiatry and society. I have seen nearly half a century of a development which I think is growing in the wrong direction. And it's time to take you even deeper than what we've had so far. My goal is to give you the tools to make up your mind. I don't really want you to decide whether you believe me or believe the people that I'm going to be critical of, that is, the claims that they are making. I want you to be able to make up your own mind. Probably I would lose that battle if it's just, are you going to believe me or are you going to believe them? I don't want you to believe anybody. I want you to make up your own mind based on the information that you get and the thinking that you do. In order to try to do that, I want to pick up from where I was and take you deeper. In the previous sessions, I gave you a background of the kinds of things that I have, work that I have done, things that I have seen, introduced you to the basic problem that psychiatry, for defensive reasons, for reasons of protecting itself, not for scientific reasons, starting about 40 or 50 years ago, went in a medical direction, claiming that mental disorders, mental distress, behavioral problems, and all the rest were due to medical conditions residing in the brain. I want to talk to you more now in the next 3, maybe 4, possibly even 5 sessions to give you the information about why that is wrong. It's not true. Now, in order to do that, history is terribly important. I think you all know that if you want to understand the present and look forward to the future in the wisest direction, you better start with the past, because there's nowhere else place to start. How could you learn about the present if you don't learn about the developments leading to it? If you have any chance of predicting what's going to happen in the future, it's because you've started with the past and then study what's happening now and then move on. So let me start tonight by giving you a little more about the desperation that psychiatry brought to this so-called medical revolution, this biological revolution that it started claiming it was finding and developing. Basically, just about the time that I was going through the training to become a psychiatrist in the 60s, psychiatry was under attack because of what came to be called, in many different ways, but some of you are old enough to remember, most of you not, what's been called the greening of America. There was a very good-selling book by that title, The Greening of America. I don't remember the author. But basically, it was the 60s. More and more people were beginning to question authority, question the establishment. Remember, Vietnam was growing. People were beginning to question whether elder white men were leading the country in the direction that we liked. I don't need to belabor that. I think you all either remember it or you have heard about it. It means that people were questioning authority. Well, if we narrow that down to the question of these sessions, psychiatry and society, what it came down to was, is it really a good idea to have psychiatrists always the ones who are considered the authorities in the mental health field? Psychologists, social workers, counselors who were getting licensed for the first time. Before that, they could not do therapy. More and more people were now getting the credentials, And if the business was to help people with their emotional problems, behavioral problems, why should psychiatrists be the ones that we always put at the top of the heap? Psychiatry didn't like that questioning. And so what happened was they developed, in essence, a cartel. Now, I can't give you an order of exactly who did what month by month, but let me tell you what became the basic elements which made up this cartel. First of all, it was the psychiatrists themselves. But in addition, they gradually got closer and closer to a pharmaceutical industry, which was anxious to increase their profits. That's what businesses do. The government was getting more and more money for mental health funding. It was an outgrowth of World War II, the recognition that there was a need to respond to the needs of veterans. Mental health funding was increasing. And then there were some drugs that developed which, no question, could change people in their behavior and their mental state. They were basically tranquilizing medications, and they were used starting in the 50s in mental institutions, and people could be tranquilized such that they were easier to handle. It also happened that there was a movement to move a lot of people out of mental hospitals into community facilities. The states liked that because the funding or the paying for it was going to shift to a significant degree to the federal government, so the state governments were happy about that. Now, these were many times not really mental patients. Many people assume that anybody residing in a state mental hospital was a mental patient, having a mental disorder. No, many of these people were old, senility and old age degeneration, or medical disorders which would manifest themselves in thinking deficits, retardation, so forth. Everybody was kind of being lumped together. So the reduction of patients in those facilities was not due to any great breakthrough in treating mental disorders like psychotic breakdowns, major depressions, behavioral disorders, and so forth. But drugs were developed which would change people, and psychiatry began to collaborate with the pharmaceutical industry and the government in creating a message which said, this is a biological revolution. That is, we have discovered that these changes that we are causing in people is because we are treating a disease. Now, think about what that would mean. If you are the psychiatric profession and you are fending off the people who are claiming that you MDs, you psychiatrists, you shouldn't be the leaders, you should just be one of the group of people who help citizens with mental problems. You can begin to see how it shakes down. You've got two sides there. You've got the people that want a kind of multidisciplinary mental health system where the psychiatrists do not dominate things because the problems are not known to be medical diseases. And then you've got the medical doctors in collaboration with governmental agencies and the drug companies who want to conceive it as treating diseases. Just to say a little more about who these people that were critical of psychiatry, it was not only just, say, some ex-patient groups, not only the people who were the non-medical psychotherapists, but the gay community. Psychiatry at that time listed homosexuality as a mental disorder. The gay community, which was growing in confidence in themselves, said, what do you mean? Who says we have a mental disorder? This is what we choose. They successfully got the psychiatrist to change and take out homosexuality from the diagnostic manual. Except if you don't like it, then we'll call it, if you wish you were not gay, then we'll say you have a mental disorder. People began to say, that doesn't look like very scientific to me. So you had this battle going on. And we're going to go in now into showing you how it is that psychiatry, instead of discovering diseases, instead, in collaboration with the pharmaceutical industry, government, and a massive public relations campaign, created a model which says we are treating diseases, that these drugs are treatments. And to me, it's very, very clear, and the psychiatric profession really does admit it if you read the articles that they publish for each other, but not what they say to the public. They haven't found any diseases of the brain. And I ask you, if you haven't found any diseases, then how can it be that the things they do to people's brains via drugs or electric shock, how can you claim that you're treating a disease if you haven't found any diseases? So the so-called biological revolution in psychiatry is nothing more than doing something other than finding diseases, specifically enumerating the symptoms that you have and calling that a disease. And then the things that the physical things they do to you, calling that a treatment. So real doctors treat diseases that can be demonstrated, and whether there's progress or not can be demonstrated. Psychiatrists are creating pseudo-diseases. And then the changes that are made to somebody by drugs or shock are called treatment. So next session, we're going to go into the heart of what real doctors do and what psychiatrists do, and you're going to see just how different it is. Please come back next time. I see you then.